Hello students, welcome to this session. Let's study human anatomy and physiology.
Hello students, from today we will have lectures on anatomy and physiology. So what is anatomy? Anatomy is study of the structure of the body parts and physiology is functions of the body parts. So first is
1.1 Common anatomical terms. Anatomy study of normal structure of body. Physiology study of normal functions of body. Planes of body. Various parts of body are described in relation to certain imaginary line. Median plane, the line which runs through the center of the body is median plane. Medial, the structure nearer to the median plane. Lateral, away from the median plane. Internal, near to the center of the cavity. External, away from the center of the cavity. Superficial, near to the surface. Deep, away from the surface. Anterior, near to the front. Ventral, near to the front of body is ventral. Posterior structure which is near to back of the body. Dorsal, near to back of the body, near to the back of the body. Then proximal, the near to any point is proximal, away from any point is distal. Anatomical position, one body is situated from position with arms by sides, palms of the hands facing forward, head erect and eyes looking straight in front. Osteology, study of bones. Arthrology, study of joints. Neurology, study of nerves. Myology, study of muscles. Histology, study of tissue. Cytology, study of cells. 1.2 Different systems of human body. So first is cardiovascular system, respiratory system, excretory system, digestive system, skeletal, male reproductive, female reproductive system, endocrine, nervous, sensory system. Let's study cell.
basic unit of the body is cell. So what is cell? It is a functional and structural unit of the body. So what are the components of the cell? So cell is having the covering that is called as cell membrane. It is semi-permeable. That means it is only half permeable. So the things from inside the cell to outside is not permeable, and from outside to inside cell, that is water or other chemicals, are permeable. So it is called as semi-permeable in function. So now what is protoplasm? Protoplasm is the liquid constituent present inside the cell membrane. So protoplasm is consists of cytoplasm plus nucleus. So what is cytoplasm? It is water plus all biochemical compounds like sodium, potassium, chloride or carbohydrates, lipids, proteins, amino acids. So all these present inside the cell that is with water, it is called as cytoplasm. And nucleus, the central portion of the cell, is called as nucleus, which performs the function of cell division, and it carries the hereditary characters from one cell to other cell, that is from one generation to other generation, because it contains DNA in form of chromosomes. And the other things which are present in cytoplasm, they are mitochondria. So the mitochondria, its main function is powerhouse of energy. So ATP is generated, that is energy, and therefore it is called as powerhouse of energy. Endoplasmic reticulum, so it is a network of the thing which is present around the nucleus, is called as endoplasmic reticulum. Golgi complex, it is sac-like structure present near the nucleus or in cytoplasm, it is called as Golgi complex. And ribosomes, these are again small structures present on endoplasmic reticulum, they are called as ribosomes. So endoplasmic reticulum, Golgi complex and ribosomes, they help in protein synthesis. And sac-like structures present in cytoplasm, they are also called as lysosome, which contains lytic enzymes for the lysis or breakdown of the foreign material. Thank you. Now today we will see about tissue. So what is tissue? It is aggregation of cells to perform single function, is called as tissue. So there are total 4 types. So one is epithelial tissue. So it is of 2 types, simple and stratified. And simple is squamous, cuboidal and columnar. So function of epithelial tissue is mainly covering of the body. Example by skin, so protection. Then covering of organs like liver, kidney. Protection of body and organs. It is main function of the epithelial tissue. Second is connective tissue. So mainly it is blood, that is liquid connective tissue. Then fibrous tissue, elastic tissue, adipose, reticular tissue and cartilage. So cartilage is of three types: hyaline, fibrous, and elastic cartilage. So function of connective tissue and cartilage is connect systems, covering, protection, and shock absorption by adipose tissue. Third is callus tissue. So it is mainly bone, and bone is of two types: spongy and compact. So when the Haversian system is complete in that bone, it is called as compact bone, and when it is not complete, it is called as spongy bone. Or other types of bones is long bone like femur, humerus, short bone like carpals, metacarpals, irregular bone like vertebra, sesamoid bone like patella. So sesamoid bone means from the tendon the bone is developed. It is called as sesamoid bone. So function of bone is protection of body organs, site for hemopoiesis, that is present in bone marrow, then calcium and phosphorus storage, and two or more bones form joints, and joints are required for the locomotion or movements. Fourth is muscular tissue. So it is of three types: skeletal muscles, so the which connects to the bones, so it's called skeletal muscles. The function is movement of the body. Then smooth muscles, which are present inside the organs, so movement of the organs, and cardiac muscles, which are present in heart, so movement of the heart like systole and diastole. So systole is contraction of the heart, and diastole is relaxation of the heart. Fifth tissue.
So nervous tissue is a specialized tissue which transmits the stimuli. So in characteristics, neuron is a structural and functional unit of the nervous system. The cytoplasm present in the nerve cells is called as neuroplasm, and the covering is called as neuralema. Now neurons have lost permanently the power of division because they do not have centriole, so they do not divide, and the function of the neuron is transmission of nerve impulses. So here also you can see cell body, then short fibers are dendrites, and then long fiber is axon, and the cytoplasm present in axon is exoplasm, and the membrane is called as exolema, and the myelin sheath, that is fatty covering, is there. So the myelinated fibers are present in central nervous system, and non-myelinated fibers are present in autonomous nervous system. Now we will see classification of the neurons. So according to the structure, they are divided into three types: unipolar, bipolar, and multipolar. So unipolar, it gives a single fiber, single process, which divides into dendron and axon. The bipolar neuron, it has two processes, one dendron and one axon. Multipolar neuron, it has several dendrons and one axon, and it is seen in motor neuron of the spinal cord. According to the functions, they are divided into sensory, motor, and mixed fibers. So sensory neuron is called as the neuron which carries impulses from sensory organ like skin, eye, ear, tongue. So these are all sensory organs. So from sensory organ to the central nervous system, that is brain or spinal cord. So that is called a sensory fiber. And the motor fiber, which carries impulses from central nervous system to the effector organ where we have to take the action, that is muscles. So it is called as motor neuron. And the mixed fibers, they contain both the parts of the sensory and motor fibers. Third type is according to the myelin sheath. They are divided into myelinated nerve fibers or non-myelinated nerve fibers.
Hello students, welcome to this session. Let's study circulatory system.
Hello students, today we will see about circulatory system. So circulatory system consists of blood vessels and heart. So we will study heart in detail. So heart is located in between two lungs in the thorax. Then coverings of the heart, there are four coverings. So here the formula of four. Four coverings: epicardium, myocardium, endocardium, pericardium. Pericardium of two layers, inner visceral and outer parietal layer, and then in between that the fluid which is called as pericardial fluid present, and it prevents it gives protection and nutrition to the heart. So four chambers, two atria and two ventricles. So two atria means left atrium, right atrium, and two ventricle means left ventricle, right ventricle. Four valves, two atrioventricular valves. So one is bicuspid and tricuspid valve, and two semilunar valves. So aortic and pulmonary valve. And functions of valves is to prevent backflow of the blood. Four great vessels: superior vena cava, inferior vena cava, pulmonary vein, pulmonary artery, and aorta. Total three circulations are there: pulmonary circulation, systemic circulation, coronary circulation. So pulmonary circulation, when there is the exchange of blood between lungs and heart, it is called as pulmonary circulation, and it takes place through pulmonary veins and pulmonary artery. Systemic circulation, exchange of blood between the body and heart. So it takes place between all four chambers and all four great vessels like aorta, superior vena cava, inferior vena cava. Then coronary circulation, it is the branches of coronary artery, that is left and right coronary arteries. They arise from aorta and then supply oxygenated blood all over the atria and ventricles. It is called as coronary circulation. So it is through coronary arteries.
So blood vessels, there are few different kinds of blood vessels. So first is artery. So this is the artery which carry, so it is a blood vessel which carry blood from the heart. So it is away from the heart. So it is thick walled artery because it carry blood under the increased pressure. Then branches of artery is called as arteriole. Then smallest branches of the blood vessels is called as capillaries. Then capillaries join and form venules, and venule join and form the vein. So important great vessel is vena cava, which is formed by combination of the superior vena cava and inferior vena cava. Now we will see difference between artery and vein. So artery is the blood vessel which carry blood away from heart. Vein is the blood vessel which carry blood towards the heart. So artery carries oxygenated blood except pulmonary artery. Vein carries deoxygenated blood except pulmonary vein. Arteries are deep in location, veins are superficial. Artery wall is thick because it carries blood under increased pressure, and vein wall is thin because it carries blood under normal pressure. So arterial blood collection is used for the blood gas analysis, and mainly radial artery is used, and veins are superficial, so easily we can do collection for all biochemical and serological testing.
Cardiac cycle, there are four steps in that, or stages. So first is atrial systole. So when atrium contracts, it pushes its blood to the ventricles. Then ventricle contracts, it pushes its blood to the aorta and pulmonary arteries. And then the blood is from aorta supplied all over the body, and pulmonary artery blood goes to the lungs for the oxygenation. And then atrial diastole, the atria relaxes and the blood from all over part of the body is received in the atrial chamber. So atria are receiving chambers. And then ventricular diastole. So ventricular diastole, the ventricles are ready to receive the blood from atria, and the cycle, that is cardiac cycle, continues. Thank you.
Arterial blood pressure. So blood pressure is defined as the lateral pressure exerted by blood against the vessel walls. So it is of two types, systolic and diastolic. So the maximum pressure exerted when the ventricular contraction, it is called as the systolic pressure, and the minimum pressure when during the ventricular relaxation, that is diastole, is called diastolic pressure. The normal blood pressure is 120/80. That means systolic pressure is 120 millimeter of mercury and diastolic pressure is 80 millimeter of mercury. The blood pressure is measured by apparatus called as a sphygmomanometer, and when there is more than 140/90 millimeter of mercury blood pressure, it is called as hypertension. There are few factors which affect the blood pressure. So cardiac output, blood volume, viscosity of blood, age, sex, build, and sleep and emotion. And in pathological conditions, it is kidney disease, anemia, or high level of the cholesterol and triglyceride in the blood, that is obesity.
Hello students, welcome to this session. Let's study respiratory system.
Hello students, today we will see about respiratory system. So what is the definition? It is a system which includes the parts which required for the air passage and lungs where gases exchange takes place. So functions of respiratory system is mainly respiration and voice production because of the presence of the larynx in the respiratory system. So these are the parts of the respiratory system. In this diagram you can see. So it continues with the nose, then pharynx, that is nasopharynx, then larynx, then trachea, that is a windpipe, and then bronchus. There are two, right bronchus and left bronchus, and then bronchioles, and then it consists of the lungs.
Lungs. The two lungs are essential organs of respiration. They are soft, spongy, and elastic structures. The lobes, right lung has 3 lobes and left lung has 2 lobes. location, they occupy most of the thoracic cavity. Each lung is conical structure with its base resting on the diaphragm and apex directed towards the neck. The alveoli, with each inhalation, air passes by way of bronchial tree to alveoli. Air and alveolar sac is made up of simple squamous epithelium surrounded by blood capillaries. Gas exchange occurs between air in the alveoli and blood in the capillaries. Oxygen diffuses across the alveolar and capillary walls to enter the bloodstream, while carbon dioxide diffuses from blood across the walls to enter the alveoli. The alveoli must stay open to receive the inhaled air if gas exchange is to occur. The alveoli are lined with surfactant, a film of the lipoprotein that lowers the surface tension and prevents them from closing. The lungs collapse in newborn babies who lack this film, and condition is called infant respiratory distress syndrome and now treatable by surfactant replacement therapy.
So covering of the lungs, there are two coverings. It is called as pleura. So inner visceral layer and outer parietal layer, and the space is called as pleural space, and in that pleural fluid is present, and function of pleural fluid is mainly to lubricate this pleura and the protection of lungs from injury shock, and then gives nutrition to the lungs. Breathing movements in man, so it is a mechanism in which two movements are there, that is inspiration and expiration. So what is inspiration? It is intake of the air, and expiration is expulsion of the or removal of the air. So in that, the diaphragm, intercostal muscles, ribs and sternum, these are the parts mainly required for the breathing mechanism. So in that diaphragm, in inspiration it is an active process, and expiration is a passive process. So in inspiration, diaphragm contracts and it flattens, and expiration, diaphragm relaxes and it moves upwards. Then intercostal muscles contract. In expiration, intercostal muscles relax. Then ribs and sternum. So in inspiration, ribs and sternum moves upwards and outwards, and in expiration, the ribs and sternum moves downwards and inwards. So in this way, inspiration, in that thoracic volume is increased and pressure is decreased, and therefore air is moved in. म्हणजे व्हॉल्यूम वाढतो, प्रेशर कमी होतं आणि मग हवा आतमध्ये येते. जसं आपण फुगा फुगवताना आपण व्हॉल्यूम वाढवतो आणि मग हवा आतमध्ये जाते. अँड देन इन एक्सपिरेशन the thoracic volume decreases because air pressure increases, and then air is moved out. So like it happens in a balloon की ज्याच्यामध्ये आपण बाहेरून प्रेशर दिला तर हवा बाहेर निघते. So this is in short inspiration and expiration. Thank you.
Tidal volume is the volume of air moving in and out of lungs with each normal breath is called tidal volume. It is about 500 ml. Vital capacity, the lungs are filled to maximum capacity by enforced inspiration. The volume of air 4 to 6 liters in the lungs is called vital capacity. The forced inspiration usually increases the volume of air beyond the tidal volume by 2900 ml, and that amount is called inspiratory reserve volume. We can increase the amount of air expired by contracting the abdominal and internal intercostal muscles. This is so-called expiratory reserve volume. This is about 1400 ml of air. Vital capacity is the sum of tidal plus inspiratory reserve plus expiratory reserve volume. Residual volume, even after enforced expiration, some air always remain in lung. This is about 1.5 liter. This is called residual air. The residual air ensures that some carbon dioxide always remain in our circulation with each breath. This air is not as useful for gas exchange because it has been depleted of oxygen. In some lung diseases such as emphysema, the residual volume builds up because the individual has difficulty emptying the lungs. This means that the vital capacity is reduced because the lungs have more residual volume.
So today we will see digestive system, which is mainly required for the digestion of the food which we take in form of carbohydrates, lipids, proteins and a few vitamins and minerals. So carbohydrate is digested and absorbed as glucose, lipids digested to fatty acid plus glycerol and then absorbed, and proteins digested to amino acids and then they are absorbed in the blood. So first part is mouth, which is also called as buccal cavity, which contains tongue and teeth. So tongue mainly required for the mixing of food with saliva and swallowing. teeth required for the breaking of the food. So total in adults 32 type number of teeth, and then types are incisor, canines, premolars and molars. Salivary glands which are present in mouth, they are parotid, submandibular and sublingual, which opens into the buccal cavity, and then they secrete saliva, and which contains amylase, which is required for the digestion of the carbohydrate. Second part is esophagus. So food goes to esophagus and then to stomach. So stomach three parts: fundus, body and pylorus, which is required for the digestion of the proteins, which contains pepsin, and water, glucose, drugs absorption. The next part is small intestine, which is of three parts: duodenum, jejunum and ileum. So this small intestine contains three types of juices for digestion of food. So intestinal juice for digestion of proteins, bile juice for digestion of fats, pancreatic juice for carbohydrates. So in small intestine, the whole food is getting digested, broken down and then absorbed. Large intestine is of three parts, like colon, which is descending colon, ascending colon, transverse colon, sigmoid colon, and then rectum, and then anal canal and anus. So mainly large intestine is for the storage of the undigested food and then defecation, that is removal of the undigested food from the anus. Then accessory glands are present in digestive system. They are salivary glands. Second is liver. So it is present in right side of the abdomen, which secretes bile, and that is mainly for the digestion and absorption of the fat. Gallbladder, which is small sac-like structure near the liver, which store and concentrates bile. Pancreas, which is present in C-shaped curve of the duodenum, and it has two parts: exocrine part, which secretes pancreatic juice, which contains amylase and for digestion of carbohydrate, and endocrine part, that is beta cells of Langerhans, which secretes insulin, and it is mainly for the regulation of the blood sugar level. So this is about digestive system. Thank you.
Digestion and absorption of the food, like carbohydrates, lipids, and proteins. So first in salivary gland, in saliva, salivary amylase is there, which converts good starch into maltose. In stomach, gastric juice, pepsin, and HCl is there. So they do digestion of proteins into polypeptides and peptide. Then pancreas, pancreatic juice is there, which contains trypsin, bicarbonate, pancreatic amylase, and lipase. So trypsin causes polypeptides, peptones into amino acids, pancreatic amylase, starch into maltose, lipase into fats into fatty acid plus glycerol. Liver, bile juice is there, which contains bile salts that causes absorption of fats. Small intestine, intestinal juice is there. So trypsin, polypeptides into amino acid, invertase, sucrose into glucose, maltase, maltose into glucose. And in large intestine, mucus, which secretes for lubrication of the feces and absorption of water from the feces. Absorption is the taking in of digestive food molecules from lumen of small intestine into blood capillaries. So carbohydrates digestion into monosaccharides and simple sugar, and then they are absorbed. Protein absorbed as amino acids, lipids absorbed as fatty acid and glycerol. Then these sugars and amino acids are absorbed into capillary network, and fatty acid and glycerol are absorbed into lacteals in the villi. The lacteals are part of liver system. In this way, the fat absorbed by lacteals reach to the circulating blood. Students, welcome to this session. Let's study excretory system.
Hello students, today we will see excretory system of man. So excretory system, that is urinary system of man, it contains kidneys 2 in number, ureter 2 in number, then urinary bladder 1 in number and urethra 1 in number. So the main part of the excretory system is kidney. So here you can see kidney, the outer portion is called as cortex, the inner portion is called as medulla, and here you can see calyces, and the bulging of that is renal pelvis, and renal pelvis then opens into the ureter. So number of kidneys 2, and location mainly it is in lumbar region. So the unit of the excretory system is nephron, that is uriniferous tubule, and you can see here this diagram and the parts. So mainly it is first is glomerulus, which is capillary network, then Bowman's capsule, which is a cup-shaped structure at the start of the tubule, then renal tubule, which consists of proximal convoluted tubule, which arises from the Bowman's capsule, Then continues with the loop of Henle. It has two parts, ascending loop and descending loop. Then distal convoluted tubule, and then collecting duct which opens into the pelvis, and then from pelvis the urine goes to the ureter and then to the bladder, and then through the urethra it is excreted out. So functions of kidney mainly formation of urine, water balance, acid base balance, electrolyte balance, and other like maintenance of blood pressure, volume, and synthesis of erythropoietin hormone, which is required for the erythropoiesis. Formation of urine takes place in three stages: ultrafiltration, reabsorption, and secretion. So ultrafiltration takes place in Bowman's capsule. The liquid portion from the blood is filtered through Bowman's capsule except the cells and proteins. Then reabsorption of the unwanted substances like glucose, amino acids, that are taken in the proximal convoluted tubule. Then secretion of harmful substances like ammonia, urea, potassium, hydrogen ions, they are secreted into the distal convoluted tubule, and then it goes to the collecting duct, from collecting duct to pelvis, pelvis to ureter, and then when bladder is full it is excreted out, that is called as micturition. Thank you.
Hello students, welcome to this session. So today we are going to study male reproductive system. So in this diagram you can see male reproductive system: testes, epididymis, vas deferens, seminal vesicles, prostate gland, Copper's gland, and penis. So let's study each in detail. So first is the most main important organ of the male reproductive system is the testes. So they are paired oval testes, lie outside the abdominal cavity in man in a skin covered special sac called scrotum. In transverse section they contain many seminiferous tubules, and these cells undergo process of spermatogenesis to produce spermatozoa. Between seminiferous tubules are numerous microscopic interstitial cells are there. They are also called as Leydig cells, which produce a male hormone, that is testosterone. And this testosterone is responsible for the all male characteristics. So let's see functions of the testes. So function of testes main is the production of sperms, which is required for the fertilization with ova to produce a fetus, that is zygote and then fetus. Then second function is synthesis of male sex hormone testosterone by Leydig cells, that is interstitial cells, and this hormone is responsible for male secondary sexual characteristics such as deep voice, male hair distribution, that is beard, and axillary or hair on chest, then typical distribution, fat, build. All these male characteristics are responsible because of the hormone testosterone. Second is epididymis. So it is located on the surface of the testes. The function of this epididymis is storage of sperms before ejaculation and increase fertilizing power of the sperms. Third is a vas deferens. So it is the duct which arises from the epididymis. It is also called as ductus deferens or vas deferens, and it enters the abdominal cavity, then arches over the bladder and opens into the back of the urethra. Next is the seminal vesicle. So they are sacculated pouches on each side of the testes, situated between base of the urinary bladder in front and the rectum behind. The glands secrete alkaline secretion and fructose of the semen, that is composition of the semen. Next is the prostate gland. So it is donut shaped structure formed only in males and surround the first portion of the urethra. Its alkaline secretion protects the sperms from acidic environment in the male urethra and female vagina, and thereby increases sperm motility so that fertilization can occur more easily. It secretes acid phosphatase, hyaluronidase, and fibrogenase. Hello students, welcome to this session. So today we are going to study female reproductive system. The parts of female reproductive system are ovaries, they are 2 in number, uterus 1 in number, uterine tubes 2, then vagina, Bartholin's and vestibular glands, and mammary glands. The first part of the female reproductive system is ovaries. So there are 2 oval bodies located in lower abdomen just below and behind the uterine tubes. The functions of the ovary, one is to produce eggs and second to produce female sex hormones, that is estrogen and progesterone, which are required for the female sexual characteristics. The transverse section of ovary, the capsule is the covering epithelium called as tunica albuginea, and the inner part is called stroma, which contains the outer part cortex, which contains ovarian follicles, and the inner part of stroma is called medulla. The ovarian follicles are the basic units of the female reproductive biology. Each of them contains a single oocyte, that is immature ovum, granulosa cells and theca.
Then second is the uterus. So both oviducts open into wider tube. The uterus measures 3 by 2 by 1 in inches in size, and the parts of uterus are fundus, body and cervix. So upper part is fundus, then central part is body, and cervix is a narrow portion opening into vagina. The cervix secretes protective antibodies, and natural acidity of vagina prevents the growth of harmful bacteria during and after menstruation. The uterus undergoes cyclic changes from puberty to menopause, and this is called as menstrual cycle. And then endometrium develops each month to provide nutrition to fertilize egg. The next part is uterine tubes. The uterine tubes consist of proximal part called oviducts and the distal part called fallopian tubes. At the distal end, each fallopian tube expands into funnel-like infundibulum having fringe-like projections called fimbria to catch the ova that is released in ovulation.
Now let's study menstrual cycle, the characteristic feature of the females. The menarche is the onset of menses at puberty until menopause. A woman's reproductive system undergoes cyclical changes, and each cycle is around 28 to 29 days. There are 4 phases: menstrual phase, follicular phase, ovulatory phase and luteal phase. So in menstrual phase it is destructive phase, that is bleeding takes place. So it is about 3 to 5 days, and it is because of the breakdown of the endometrial lining and blood vessels. And lack of menstruation, the reasons are pregnancy, stress, poor health. Then follicular phase, so in that estrogen is increased. It is proliferative phase. The follicles, primary follicles converted into a Graafian follicle, and endometrium undergoes proliferation. Ovulatory phase, it is because of the LH and FSH, it is present in the middle of the cycle, that is 14th day, and LH surge causes ovulation. The luteal phase, it is secretory phase. So in that Graafian follicle forms corpus luteum, which secretes progesterone, which is required for the maintenance of endometrium, implantation of fertilized ovum for the pregnancy. Then absence of fertilization, corpus luteum degenerate, disintegration of endometrium, and then bleeding phase. The menstrual hygiene and sanitation should be properly maintained by use of sanitary napkins and proper disposal of the sanitary napkins. The menopause is a stoppage of the menstrual cycle, and it is at the age of around 50 years. Now let's study gametogenesis in female, is called as oogenesis. So oogenesis is the mature female gamete formation. So is initiated during the embryonic development stage when couple of million gamete mother cells, that is oogonia, are formed within each fetal ovary. No more oogonia are formed and added after birth. These cells start division and enter into prophase 1 of the meiotic division and get temporarily arrested at that stage, called primary oocytes. Each primary oocyte then surrounded by layer of granulosa cells and is called primary follicle. A large number of these follicles degenerate during the phase from birth to puberty, and therefore at puberty only 60,000 to 80,000 primary follicles are left in the each ovary. The development oogonia, that is gamete mother cells in the fetal ovary. So in meiosis prophase 1, they are converted into primary oocytes surrounded by granulosa cells, are called as primary follicle. The primary follicle then surrounded by granulosa cells and theca cells is called secondary follicle. Then is converted into the tertiary follicle, which contains cavity which filled with the fluid called antrum. The theca is divided into two parts, inner theca interna and outer theca externa. And inside that primary oocyte undergoes meiosis 1, and then it is developed into secondary oocyte, which is haploid and first polar body. Then mature follicle is formed, called as Graafian follicle, and secondary oocyte, the new membrane is formed, that is called zona pellucida. So this zona pellucida is required for the binding of the spermatozoa and is then required to initiate the acrosome reaction. The Graafian follicle then rupture, secondary oocyte, that is ovum, released and is called as ovulation. Now let's study fertilization process. So sperms enter into the vagina, that is called insemination. So then they travel to cervix, then to uterus, and then the ampullary part of the fallopian tube. Then from the ovary, ovum is released. In the ampullary part of the fallopian tube, the fertilization takes place. So for the fertilization, the ovum is released in the ovulation time, that is around 14th day of the mid cycle, and that time sperms are there. They should be there available for the 72 hours, and then the fertilization process takes place. So the sperms, they enter the zona pellucida of the ovum by secretion of acrosome, that is digestive enzymes. Then they enter into the ovum. So the secondary oocyte meiosis 2 takes place, and then haploid ovum plus second polar body is formed, and then sperm plus ovum unite, and then it forms zygote, that is diploid. After fertilization, the next process is implantation. So zygote formed is traveling to the isthmus of the uterus, then mitosis takes place, then 2, 4, 6, 16 cells are formed, they are called as blastomers. Then 8 to 16 blastomer stage is formed, that is called as morula. Then it is converted into the blastocyst into the uterus. The blastocyst converts into the outer part tropoblast attached to the endometrium, and the inner part, inner cell mass, forms the embryo. The uterine cells divide and covers blastocysts, and it is embedded in the uterus. That is called implantation, and then pregnancy continues. Now let's see pregnancy and embryonic development. So outer portion is called as trophoblast. So it converted into the chorionic villi. They are finger-like projections in the uterine tissue, and then they attach to the uterine tissue. So they convert into the placenta, which supply oxygen, nutrients to the fetus, developing fetus, and remove carbon dioxide and waste. The hormone HCG, that is human chorionic gonadotropin, HPL, that is human prolactin, estrogen and progesterone are responsible. Then relaxin is formed in the later phase of the pregnancy by ovary, and then umbilical cord is formed, which is attached to the embryo. The inner cell mass, they form the stem cells. So outer ectoderm, middle mesoderm, and inner endoderm, they form organs. So first month heart is formed. So first heart sound is heard in first month. Second month limbs and digits are formed. Third month first trimester systems, then limbs, external genitals formed. Fifth month first movement of the baby is felt by mother. A hair on the head is there. Then 6 month second trimester, body, hair, eyelids, eyelashes formed. And then 9 months the complete fetus is formed, and then it is delivered. So parturition is the fetal ejection reflex from fully formed fetus and placenta. So in that, anterior pituitary glands increases the level of oxytocin, which causes excess contraction of the uterine smooth muscle, that is called labor, and then it helps for the expulsion of the fetus, that is called parturition, and then expulsion of the placenta. Then in lactation, the mammary glands differentiate, and the glands produce milk, that is called lactation, and the first milk is called as colostrum, which contains antibodies which gives immunity to the baby. So first part of milk is very essential for the developing baby.
Hello students, welcome to this session. Today we are going to study endocrine system. So what is exocrine gland? So there are two types of glands. So exocrine gland, the gland which releases their secretions into the duct, They are called as exocrine glands. Example, pancreatic gland or gastric glands. Then endocrine gland, the gland which release their secretion called hormone into the blood directly without duct. They are called as ductless glands. So they are called as endocrine glands. And the hormone is a secretion of endocrine glands. The hormones, they are secreted in small amount, released directly into the blood, and then carried to the target organ through the blood, and they are specific in action. So first is the pituitary gland. So pituitary gland is located in the brain on the floor of the cranium. It lies in the sphenoid bone of the skull, and it is called as master endocrine gland because it controls all other glands by its secretions. Then there are two parts of the pituitary gland, that is anterior pituitary gland and posterior pituitary gland. So anterior is called as adenohypophysis and posterior is called as neurohypophysis because it secretes neurosecretory hormones. Now we will see hormones secreted by pituitary gland. So first is the anterior pituitary gland. So it secretes the hormone thyrotropin, which acts on a thyroid gland. ACTH, that is adrenocorticotropic hormone, it acts on an adrenal gland. It is present above the renal gland. It is also called as suprarenal gland. Then other hormones for the ovaries and testes are gonadotropins, then FSH, LH, prolactin, then growth hormone, then somatotropin, which promotes the growth of the whole body. Then posterior pituitary gland secretes two hormones, mainly ADH, that is antidiuretic hormone, also called as vasopressin. It is mainly required for the water reabsorption by acting on the kidney. And second is the oxytocin, which allows uterus contraction in a labor. Now next gland, important gland, is the thyroid gland. So it is present in the neck just below the larynx or Adam's apple in the males, and it consists of two lobes on either side of the trachea.
Fifth gland is the parathyroid gland. They are 4 in number and they located in each pair at the back side of the thyroid gland. The hormone secreted by parathyroid gland is parathormone or PTH, and it is regulation for the calcium ions. The functions of the parathormone, they are acting as a hypercalcemic hormone. So it increases calcium level in the blood by bone demineralization, increase calcium reabsorption in renal tubules, and increase calcium from the digestion. Seventh gland is the pancreas. So it is leaf-shaped lobulated gland present in the C-shaped loop of the duodenum. It has 4 parts: head, neck, body and tail. And the exocrine portion, that is pancreatic duct, opens into the duodenum along with the bile duct. The functions of the pancreatic gland, so it is a mixed gland, that means it has both functions, endocrine and exocrine. So exocrine part, they are acini, which secrete pancreatic juice, which is required for the digestion of the proteins mainly, and then it is carried, that is through the pancreatic duct, and which opens into the duodenum. Then endocrine part is called as the islets of the Langerhans. So it has 3-4 types of cells, like alpha cells which secrete glucagon. So it is a hyperglycemic hormone because of the gluconeogenesis. Beta cells secrete insulin which control blood sugar level. So it is hypoglycemic hormone by the glycogenesis. Delta cells which secrete somatostatin, and PP cells secrete pancreatic polypeptide. The glucagon, that is secreted from the alpha cells, so they act on the hepatocytes, and it is a hyperglycemic hormone. So by the mechanism, increases sugar like mechanism glycogenolysis, gluconeogenesis, and it reduces cellular glucose utilization, and in this way it increases the blood sugar. And then insulin secreted from the beta cells of the Langerhans, so it acts over the hepatocytes and adipocytes, that is fat cells, and it is a hypoglycemic hormone. So the mechanism is glycogenesis, that is conversion of glucose into the glycogen. Then it inhibits gluconeogenesis and it increases cellular glucose utilization, and in this way it decreases the blood sugar in the blood. eighth gland is the adrenal gland. So it is located in the above portion of the kidney and also called as suprarenal gland. So it is a triangular gland, each present over the superior surface of the kidney, and it has two parts, medulla and cortex. So cortex is the outside portion and medulla is the inner portion. So structure of the adrenal gland, so it has two parts, outer cortex and inner medulla. So cortex is a yellowish tissue surrounding the medulla, and it is stimulated by the pituitary hormone, that is ACTH, adrenocorticotropic hormone, to produce the adrenal gland hormones. So the layers of the cortex are three, that is outer layer is also called as zona glomerulosa, middle layer is zona fasciculata, and innermost layer is the zona reticularis. And then they secrete the adrenal gland hormones, also called as corticosteroid hormones. The medulla, it is a grey core of the gland. It consists mainly of the chromaffin tissue and is stimulated by the sympathetic nervous system to produce hormones like epinephrine and norepinephrine, that is adrenaline and noradrenaline. So adrenal gland hormones, so the outer cortex, it has three layers. So outermost layer, that is zona glomerulosa, it secretes mineralocorticoids, that is aldosterone, and it helps in regulation of the minerals like sodium and potassium by the kidney, and excretion of the potassium and phosphate, and electrolyte balance, fluid balance, blood pressure control, and osmotic pressure control. Then zona fasciculata, it secretes glucocorticoid, that is cortisol or cortisone, and then it helps in the carbohydrate metabolism, that is glucose metabolism, inhibits cellular uptake and utilization of the amino acids. It is anti-inflammatory reaction and suppresses immune response and stimulates RBC production. Then the third layer is zona reticularis, so it secretes androgen, and it is mainly for the sexual characteristics, that is masculinization. Then adrenal medulla, it secretes the medullary hormone, that is catecholamines, so adrenaline, also called as epinephrine. So it has a function like increase heart rate, so it has a function for the fear, fight and flight. So increase heart rate, increase force of constriction of the heart, dilatation of coronary vessels and blood vessels supplied to skeletal muscles, pupillary dilatation, sweating, increase respiratory rate, breakdown of the glycogen and lipids and proteins. So these are the hormones secreted by adrenal medulla, that is adrenaline and non-adrenaline. So non-adrenaline stimulates sympathetic autonomous nervous system. Hello students, welcome to this session. Let's study endocrine system. So this is a summary of hormones and functions of the hormones secreted from the endocrine glands like pituitary, thyroid, parathyroid gland, adrenal gland, pancreas, ovary and testes. Increased growth hormone in childhood causes abnormal growth of body, and that is called as giantism. So in that, person will have very large hands and feet, thick toes and fingers, a prominent jaw and forehead, coarse facial features. Children with giantism may also have flat nose and large heads, lips and tongues. Headaches, vision problem and excessive sweating is there, and then severe and recurrent headaches, weakness is there, insomnia and other sleep disorders may be there. There will be delayed puberty in both boys and girls, and irregular menstrual periods in girls, and maybe deafness is also there. Increased growth hormone in adult causes disfigurement of face, and it is called as acromegaly. The symptoms in adults are acromegaly affects bones and then tissues and causes them to grow in irregular way. So there will be enlarged hands and feet, changes of face shape including more prominent jaw and forehead, increase in size of lips, nose and tongue, excessive sweating or oily skin, deepening of voice, headache, joint pain, vision changes, increase in number of skin tags, numbness in hands, sleep apnea are the symptoms present in acromegaly. Posterior pituitary gland hormone is ADH, that is antidiuretic hormone, also called as vasopressin. So deficiency of ADH causes diabetes insipidus. So in that, the decreased water conservation, that is because of the diuresis, that is polyuria. So increased urination, that is called as diuresis, and because of that there will be water loss and there will be dehydration in that patient. Second gland is the thyroid gland, and in that disorder the first is goiter. So goiter is abnormal enlargement of the thyroid gland, and it is butterfly shaped gland located at the base of the neck just below the Adam's apple. So causes for the goiter can be iodine deficiency or autoimmune diseases like Graves' disease or Hashimoto's thyroiditis, hyperthyroidism or hypothyroidism. Then the symptoms are usually goiters are painless, but large goiter may cause cough and difficult to swallow or breathe because of the pressure effect. And the investigations are done, that is thyroid function test, to investigate the effect and cause of the goiter. Hypothyroidism, it is deficiency of thyroid hormones, that is low T3 and T4, and it is because of the mainly iodine deficiency. And the causes are genetic defect in the thyroid development, post surgery, radioiodine therapy or external radiation, autoimmune thyroidism, Hashimoto's thyroiditis or iodine deficiency. And the symptoms are the enlargement of the thyroid gland, then abnormal weight gain, low metabolic activity, then you can see in this picture dryness of the skin, high cholesterol level, poor concentration and memory, muscle weakness, and generalized fatigue and unexplained weight gain. And the investigations done are T3 T4 decreased and TSH increased. The hypothyroidism in adults is called as myxedema, and hypothyroidism in infants is called as cretinism, and these two conditions we will see in detail in the coming slides. Cretinism, it is also because of the hypothyroidism in the infancy or early childhood. So the term cretin, meaning Christian or Christ-like, so it is applied to those who are unfortunates and they are so mentally retarded, so they are incapable of sinning. The cause is the severity of the mental impairment related to the time at which the thyroid deficiency occurs in utero. So normally T3 T4 crosses placenta and it is required for the fetal brain development. If there is maternal thyroid deficiency before the development of fetal thyroid gland, the mental retardation is severe. Clinically, there is big swollen protruded tongue, mouth is always open, low mental and physical activity, impaired development of skeletal and central nervous system. Because of that, there is mental retardation, short stature, coarse facial features and umbilical hernia. And investigation of thyroid function test, T3 T4 are decreased and TSH, that is thyroid stimulating hormone, is increased. Myxedema, so it is hypothyroidism developed in the older child or the adult. Clinically, myxedema is marked by slowing of the physical and mental activity, generalized fatigue, apathy, mental sluggishness, and which may resemble to the depression. Speech and intellectual functions are slowed and they are listless, cold intolerant, so they cannot tolerate cold. Frequently they are overweight, constipation and decreased sweating is there, skin is cool and pale because of the decreased blood flow, reduced cardiac output, and because of that shortness of the breath and decreased exercise capacity, broadening and coarsening of the facial features, enlargement of the tongue, deepening of the voice, tiredness, heavy menstrual bleeding in female, hair loss and slow heart rate. And then investigations of the thyroid function test, T3 T4 are decreased and TSH is increased. Hyperthyroidism, it is increased secretion of thyroid hormones. It is mostly because of the hyperfunction of the thyroid gland. And thyrotoxicosis is hypermetabolic state of the elevated levels of the T3 and T4. The causes of the hyperthyroidism: diffuse hyperplasia, also called as Graves' disease, or toxic multinodular goiter, toxic adenoma, iodine-induced hyperthyroidism, or neonatal thyrotoxicosis because of the maternal Graves' disease. And the symptoms are enlargement of the thyroid gland, weight loss, nervousness, fatigability, excessive sweating, increased body temperature, heart rate is increased, tremors, that is shaking of the hands, protrusion of eyeball, also called as exophthalmos, and because of that the eye is open and sometimes eye may become dry, and the investigations T3 T4 are increased and TSH is decreased. Graves' disease, it is most common cause of hyperthyroidism, characterized by triad of the thyrotoxicosis, ophthalmopathy, that is exophthalmos, and dermopathy. The Graves' disease is an autoimmune disorder caused by the activation of thyroid epithelial cells by autoantibodies to the thyroid TSH receptor. The thyroid in Graves' disease is characterized by diffuse hypertrophy and hyperplasia of the follicles and lymphoid infiltrates. Investigations done, so in that elevation of the T3 and T4 and TRAB, that is thyroid receptor antibody test, is positive. Pancreas, the insulin is produced by pancreas, and the deficiency of insulin causes diabetes mellitus. So diabetes mellitus is a group of metabolic disease in which there are high blood sugar levels over a prolonged period. So diabetes is due to either pancreas not producing enough insulin or the cells of the body not responding properly to the insulin produced. So the classification of diabetes mellitus, the types are type 1 diabetes mellitus, type 2 diabetes mellitus, and gestational diabetes. That means the diabetes is seen only in the pregnancy. Now we will see role of insulin. So insulin usually balances blood sugar level in the body. So how it happens? So it inhibits the breakdown of glycogen, that is glycogenolysis. It inhibits the process of gluconeogenesis, that is production of glucose from other non-carbohydrate sources like fats and proteins. It stimulates the transport of glucose into muscle cells. Then it stimulates the storage of glucose in form of glycogen, that is glycogenesis. So in this way insulin helps to balance the blood sugar level in the blood. Now we will see types of diabetes mellitus. So there are two mainly, type 1 diabetes and type 2 diabetes. So type 1 diabetes, it results from the pancreas failure to produce enough insulin, and it was previously called as insulin dependent diabetes mellitus or juvenile diabetes because it is seen in mainly children. And type 1 diabetes mellitus is characterized by loss of insulin producing beta cells of the islets of Langerhans in pancreas, and which give rise to insulin deficiency. Type 2 diabetes is insulin resistance, a condition in which cells fail to respond to insulin properly. So this form previously called as non-insulin dependent diabetes mellitus or adult onset diabetes. The most common cause of the type 2 diabetes is in adults because of the excessive body weight and not enough exercise. So obesity, which is body mass index more than 30, lack of physical activity, poor diet, stress and urbanization. And dietary factors like consumption of sugar or sweet drinks in excess or fat. So saturated fats and trans fatty acids increases the risk, and polyunsaturated and monounsaturated fat decreases the risk of diabetes. Eating lots of white rice also increases the risk of diabetes mellitus, that is type 2. In diabetes mellitus, the patient gives symptoms of polyphagia, that is increased craving for the food, then polydipsia, that is increased thirst for the water, and polyuria, so increased frequency of the urination. And patient also gets the symptoms of weakness, tingling and numbness in the limbs. And if the diabetes is not controlled, then complications of diabetes may be neuropathy, that is involvement of the nerves, then retinopathy, involvement of the eyes, nephropathy, involvement of the kidneys, then heart. So there can be atherosclerosis or myocardial infarction, and then because of the accumulation of the ketones, patient may get diabetic ketoacidosis or diabetic coma. So these are the complications of the uncontrolled diabetes. Adrenal gland. So first is the Addison disease. So this Addison disease is a syndrome in which it is due to the inadequate secretion of corticosteroid hormones and aldosterone by adrenal glands. So patient gets the symptoms of weakness, loss of energy, low blood pressure, dark pigmentation of the skin and irritability or low mood. Then the disease is curable by replacement of the hormone therapy. Adrenal gland. So oversecretion of the corticosteroid hormone by adrenal gland causes Cushing's syndrome, and it is because of the overstimulation of the adrenal glands by excessive amount of hormone, that is ACTH. So ACTH oversecretion, if it is because of the tumor of the pituitary gland, it is called as Cushing's disease, or it may be because of the malignant tumor in the lung or elsewhere. The symptoms of the Cushing's syndrome: rapid weight gain, moodiness, irritability, depression, muscle bone weakness, memory and attention dysfunction, osteoporosis, diabetes mellitus, hypertension, sleep disturbances, menstrual disorders in females like amenorrhea or infertility. In men, it may be impotence, hirsutism, baldness. Hirsutism means abnormal or excessive hair growth pattern at the abnormal sites, and baldness means no growth of the hair. So to summarize applied endocrinology, pituitary gland produces growth hormone. The decreased level causes dwarfism or stunted growth, and increased level in the childhood causes giantism. In adult it causes acromegaly, and the deficiency of ADH causes diabetes insipidus. Pineal gland secretes the melatonin. Thyroid gland hormone T3 and T4 deficiency causes hypothyroidism. In infancy it causes cretinism. In adults it causes myxedema. And increased level of T3 T4 causes hyperthyroidism. And autoimmune disorder, the toxic level causes thyrotoxicosis or Graves' disease. The second hormone secreted by thyroid gland is calcitonin. Parathyroid gland secretes parathormone, and decreased level causes hypocalcemia. Increased level of parathormone causes hypercalcemia. Thymus, the hormone is thymosin. Pancreas, the first hormone is insulin, so decreased level causes diabetes mellitus. The second hormone is glucagon. Adrenal gland, also called as suprarenal gland. So adrenal cortex secretes aldosterone, cortisol and androgen. The decreased level of corticoid hormones causes Addison's disease, and increased level of the corticoid hormones causes Cushing's syndrome. Medulla secretes epinephrine and norepinephrine. Testes, the hormone is testosterone. Ovary, the hormone is estrogen and progesterone.
Hello students, I am Dr. Rajeshri Mutha, MBBS DPB, Diploma Pathology and Bacteriology. Currently I am working at SMBT Hospital as a lecturer in microbiology department. So today we are going to study about the nervous system. So this is basic structure of the or parts of the nervous system. So nervous system is mainly divided into three parts, that is central nervous system, peripheral nervous system and autonomic nervous system. The central nervous system is mainly of two parts, that is brain and spinal cord. Peripheral nervous system, this is the main contains is nerves which arises from the brain and spinal cord. So cranial nerves and spinal nerves. And autonomous system is composed of sympathetic nervous system and parasympathetic nervous system. The cranial nerves are of three types: sensory nerves, so they are 1, 2 and 8 in number. Motor nerves, they are 3, 4, 6, 11 and 12. And mixed nerves 5, 7, 9 and 10. So total 12 pairs of nerves are present in cranial nerves, which arises from the brain.
So in this diagram you can see central nervous system, which consists of brain and spinal cord, and peripheral nervous system, which consists of cranial nerves and spinal nerves.
Now we will see coverings of the brain. They are also called as meninges. So brain and spinal cord are surrounded by three connective tissue membranes, and they are called as meninges. So cranial meninges, they are covering brain, and spinal meninges, they are covering spinal cord. The outermost covering of the meninges is called as dura mater. It is tough membrane. The middle layer is called as arachnoid matter, and the innermost layer, which is vascular and it is attached to the brain, is called as pia mater. Then the space between dura mater and arachnoid matter is called as subdural space, which contains the blood mainly. And arachnoid matter and pia matter, which contains the space, is called as subarachnoid space. Sub means below. So subarachnoid space between arachnoid matter and pia matter. So it mainly contains the cerebrospinal fluid. And the pia mater and arachnoid matter, also called as leptomeninges.
Now we will see ventricles of the brain. So cavities or spaces present in brain are called as ventricles, and because of that the brain weight becomes lighter. So there are mainly 4 ventricles in the brain. So first and second ventricle, they are also called as lateral ventricles. They are cavities of the cerebral hemisphere. Then third ventricle, it is present in diencephalon, and it is the first and second open into the third ventricle through opening called as foramen of Monro. And the fourth ventricle, it is seen in hindbrain, and the third ventricle opens into the fourth ventricle by a narrow passage called as aqueduct of Sylvius. And these ventricles contain the fluid that is called as cerebrospinal fluid, and in coming slides we will see in detail the cerebrospinal fluid collection and examination.
Now let's study cerebrospinal fluid. So it is a clear fluid that surrounds the brain and spinal cord. So this CSF is produced by specialized cells, that is ependymal cells, present in the choroid plexus of the ventricles of the brain. And about 125 ml of CSF at 1 minute is produced, and about 500 ml is generated every day. The function of cerebrospinal fluid is to protect brain and spinal cord from the injury. Also it provides nutrients in form of glucose to the brain and spinal cord, and the waste they are generated, they are removed through the cerebrospinal fluid. So these are main functions of the CSF. So location of CSF, it occupies the subarachnoid space, that is the space between arachnoid matter and pia mater, and the ventricular system around the brain and spinal cord. So it fills ventricles, cisterns and sulci. Sulci means these are the depressions, as well as the central canal of the spinal cord. There is also a connection from subarachnoid space to the bony labyrinth of the inner ear via perilymphatic duct, where the perilymph is continuous with the cerebrospinal fluid. And the significance of this is when there is leakage from inner ear, it may produce CSF rhinorrhea, means the CSF is throwing through the nose. It is called as CSF rhinorrhea. So this is a clinical significance of the CSF. Now the composition, so it is mainly derived from the blood plasma, but proteins are less in this. So CSF proteins mainly 15 to 40 milligram percent, glucose is 40 to 80 milligram percent. Normally RBCs are not seen in CSF, and WBCs, they are 0 to 5 per cubic millimeter. Thank you. Now what is importance of CSF collection? When we need the CSF collection, because CSF collection is not a routine procedure like we do for blood collection. So it is not easy method for the doctor and also for the patient. It is painful procedure. So the indications or where CSF is required in the meningitis. So it is the inflammation of the meninges, that is coverings of the brain. So the meningitis can be caused by virus, bacteria, tuberculosis bacteria or fungus. So to know the whether in meningitis is there or not there and which type, CSF collection is required. Then in brain hemorrhage like subarachnoid hemorrhage, in brain injury or brain tumor, CSF collection is required to know the exact pathology. Thank you. So collection of CSF is done by LP method, that is lumbar puncture method, and it is also called as spinal tap. So here lumbar puncture needle is there. So physician will first clean the part selected, that is the space between L3 and L4 lumbar vertebra. L3 means third lumbar, and L4 means fourth lumbar vertebra, the space between two vertebrae. So with cleaning with spirit swab, betadine spirit swab, the needle is inserted into the intervertebral space, that is space between two vertebra, L3 and L4 preferably, and then it will go into the skin, then bone, and then the cavity, that is CSF filled space in the central canal of the spinal cord, and then with help of syringe the CSF is collected, and then it is collected in a bulb for the examination.
Now we will see part 2, that is in detail the central nervous system and other systems. So first is central nervous system. So it consists of brain, and the brain consists of forebrain, midbrain and hindbrain. So forebrain is also called as prosencephalon. It has olfactory lobe, cerebrum, diencephalon, which consists of thalamus, hypothalamus and pituitary gland. The midbrain, also called as mesencephalon, it consists of visual reflex center and auditory reflex center. Hindbrain, also called as rhombencephalon, it consists of cerebellum, pons and medulla oblongata. So first part is forebrain. In that first part is olfactory lobe. So these are two lobes present in anterior side of the cerebrum, and the function of olfactory lobe is the sensation of the smell. The second part of the brain is cerebrum. So it is the largest area of brain, and it is divided by longitudinal fissure, that is corpus callosum, into two cerebral hemispheres. So hemi means half. So right and left hemispheres. So each hemisphere consists of four parts. So first frontal lobe, second parietal lobe, third occipital lobe and fourth temporal lobe. The outer surface of cerebrum is called as cerebral cortex, and it contains grey matter which consists of nerve cells, that is neurons, and the inner surface is called as cerebral medulla. It contains white matter, that is nerve fibers. The structure of cerebrum shows folds called as convolutions. The convolutions are made up of gyri and sulci. So gyri means upper part and sulci means deeper portion. And the gyri and sulci, they help in increasing the surface area of the brain. Functions of cerebrum. So it performs function of mental functions like memory, planning, intelligence, understanding, thinking, judgment, and many sensory, motor and visceral functions. So frontal lobe, it has areas for intelligence and memory. It has motor areas for leg, arm, trunk, neck, face and tongue. Parietal lobe, center of sensation of touch, pain, temperature and speech. Temporal lobe, center for hearing, taste and smell. Occipital lobe, center of vision. So if occipital lobe injury is there, then patient may get diplopia, that is double vision. Diencephalon, it has three parts: thalamus, hypothalamus and epithalamus. So thalamus, it is a large part present above midbrain and functions all sensory impulses except smell pass through cerebrum via thalamus. It is associated with pain and emotion, and it is also associated with alert mechanism. Hypothalamus, that is below thalamus, and it is under two cerebral hemispheres and immediately below thalamus. It forms the floor of the brain. Functions: hypothalamus controls activities of the pituitary gland by secreting releasing hormones and inhibitory hormones. So it controls the pituitary gland and then all other glands. The hypothalamus, along with the limbic system, controls emotional and behavioral patterns. They regulate the expression of pleasure, anger, fear. Hypothalamus also regulates circadian rhythm and maintains consciousness and homeostasis. The hypothalamus possesses a feeding and thirst center. It controls the food intake by satiating the feeling. Epithalamus, it is the smallest and most dorsal region of the diencephalon. It lies posterior to the thalamus. It consists of pineal gland which secretes hormone melanin which induces sleep signals. Thus epithalamus along with hypothalamus regulates sleep-wake signals. Brainstem, it is the part of the brain located between diencephalon and spinal cord. So it consists of midbrain, pons and medulla oblongata. The functions, it is situated between cerebrum and spinal cord. So brainstem coordinates functions between brain and the rest of the body by communicating information. It is responsible for controlling important body functions like blood pressure, heart rate, breathing, swallowing, consciousness. Second portion is midbrain, also called as mesencephalon. So the small stalk-like structure which connects pons and cerebellum with cerebral hemisphere is midbrain. The cerebral aqueduct, that is canal, passes through midbrain, and four swellings at dorsal portion called as corpora quadrigemina. The functions of midbrain: it controls vision, it controls hearing, that is auditory function, so it maintains balance of the body, and it is connecting link between forebrain and hindbrain. Hindbrain, which consists of first part cerebellum, so it is present just below cerebrum. It is second largest part of brain after cerebrum. The cerebellum consists of middle vermis which connects two lateral hemisphere called as cerebellar hemispheres. It is made up of outer grey matter and inner white matter. The surface is grooved, but convolutions are less prominent than cerebrum. The function of cerebellum: it coordinates muscular movements during walking and running. It plays important role in maintain posture and balance of body. It maintains muscle tone. So if any injury caused to the cerebellum, there is loss of body balance and loss of posture. The second part of the hindbrain is medulla, also called as myencephalon or medulla oblongata. It is lowermost portion of the brainstem. It is extension within skull of the upper end of spinal cord. That means medulla continues with the spinal cord. Coverings: it contains outside white matter and inner grey matter opposite to the cerebrum. Functions: it controls involuntary actions like heartbeat, circulation, respiration, peristalsis. It controls act of swallowing, vomiting, sneezing, coughing, hiccups. It conducts to and fro impulses of motor and sensory nerves. It controls flow of gastric juice, which is important for digestion of food in stomach. The third part of the hindbrain is pons. It is also called as pons varolii, and it is strip of nervous tissue which lies below midbrain and above medulla. It consists of outer white matter, inner grey matter. Functions: it connects two lateral lobes of the cerebellum and midbrain to medulla. It provides space for motor fibers which run across cerebrum and cerebellum. It is concerned with regulation of heat in body, and it is center of reflexes. The second part of the central nervous system is spinal cord. So it extends from medulla or brainstem up to the second lumbar vertebra, that is L2, and it is about 40 cm in length. It passes through foramen of magnum at the base of the skull. It has a hollow oval shaped container that is tapering slightly as it descends, and the terminal fibrous extension is called as phylum terminal. It is surrounded by a protected meninges and vertebral column. The cauda equina is pia mater, continues up to the coccyx, and it is called as the cauda equina, that is like a horse tail. The transverse section of spinal cord: so centrally it consists of central canal which is filled with the cerebrospinal fluid. The H grey matter is surrounded by the white matter. The posterior or dorsal root and anterior or ventral horn consist of the dorsal and ventral roots of the spinal nerve, and then it is formed the mixed nerve. Dorsal ventral fissure at the dorsal side, and coverings, that is meninges, that is dura mater, arachnoid matter and pia mater. The functions of the spinal cord: it plays an important role in the conduction of impulses to and fro from the brain to outlying parts. The spinal cord acts as a major center for many reflex actions of the body, and it also serves a connecting link between brain and the spinal nerves. Applied: poliomyelitis virus destroys anterior horn motor neurons, and then symptoms early are fever, headache, muscle pain, weakness, and then later paralysis occur, and patient may die due to paralysis of the respiratory tract. Peripheral nervous system. According to the origin, peripheral nerves are divided into cranial nerves and spinal nerves. The cranial nerves originating and ending from and into brain, and spinal nerves originating and ending from and into spinal cord. Cranial nerves, there are 12 pairs, that is 24 cranial nerves in number. First, olfactory function is smell. Second, optic function is vision. Third, oculomotor, eye movement. Fourth, trochlear, eye movement. Fifth, trigeminal, sensory and jaw movement. Sixth, abducens, eye movement. 7, facial, taste sensation, jaw movement. 8, auditory, hearing and balance. 9, glossopharyngeal, tongue muscle movement and sensory. 10, vagus, sensory to chest and abdomen organs, visceral organs, that is heart, lungs. 11, spinal accessory, movement of shoulder muscle. 12, hypoglossal, movement of the tongue. The second part of the peripheral nervous system are the spinal nerves. So these nerves arise from spinal cord and are called spinal nerves. The type is mixed nerve. They are formed by sensory portion, that is from the dorsal root and it is afferent, and motor portion from the ventral root, it is efferent nerve. Total 31 pairs of spinal nerves are in man. First, cervical, they are 8 in number, present in neck region. Second, thoracic spinal nerves, 12 in number, present in chest region. Third, lumbar spinal nerves, 5 in number, present in back region. Fourth, sacral spinal nerves, 5 in number, lower back region. Fifth, coccygeal spinal nerve, so they are 1 in number and they are found in the pelvic region, are called as coccygeal spinal nerve, found in region of the coccyx. So total C8, T12, L5, S5, CO1, total 31 pairs of the spinal nerves. ANS, that is autonomous nervous system. It controls the involuntary function of the body, and types are sympathetic nervous system and parasympathetic nervous system. So autonomous nervous system is a division of nervous system that supplies internal organs, smooth muscles and glands. The autonomic nervous system is a control system that acts largely unconsciously and regulates body functions like heart rate, force of contraction, digestion, respiration, pupillary response, urination, and certain reflex actions such as coughing, sneezing, swallowing, vomiting, hiccups. So this system is the primary mechanism in control of the fight and flight response.
In ANS, first sympathetic system promotes fight and flight response, corresponds with arousal and energy generation, and inhibits digestion. Parasympathetic system has been said to promote rest and digest response, promotes calming of the nerves, returning to regular function and enhancing digestion.
Sympathetic nervous system and parasympathetic nervous system try to balance each other in the body. So sympathetic nervous system is operative during emergency, parasympathetic during the normal activity. Sympathetic is regulated by the neurotransmitter epinephrine and parasympathetic by the acetylcholine. The sympathetic system functions as the increasing heartbeat, then extra blood to muscle tissue, then helps in widening of the pupils of the eyes so as to make maximum use of the available light. So it is mainly concerned with the fight and flight mechanism. Parasympathetic is decreasing heart rate, then it diverts the blood flow from muscles to stomach and intestines and help in contracting of the pupils of the eyes. So it generally helps in rest and digest mechanism. So according to the neurotransmitters, the neurons are cholinergic neurons which secrete acetylcholine, and they are present in sympathetic, parasympathetic preganglionic neurons and sympathetic and parasympathetic postganglionic neurons. And the second type is adrenergic neurons which secrete noradrenaline or norepinephrine, and they are present in sympathetic postganglionic neurons. The receptors, so acetylcholine and norepinephrine, are stored in synaptic vesicles which are present in synaptic knob, and they are released at the axon ending by exocytosis. They diffuse through the synaptic cleft and are received by respective receptors. These receptors are membrane protein located on the plasma membrane, and depending on the type of neurotransmitters received by them are divided into two types. So they are cholinergic receptors or adrenergic receptors.
Hello students, today we are going to study skeleton system. So in that, what is skeletal systems? It is internal framework of the human body which gives support, protects and provide lever for locomotion and other movements like eating, walking, talking, running, jumping. So all movements are because of the skeletal system. So human skeletal system is made up of mainly 206 bones and it is of the 20% of the body weight. And main function is to give support, forms the locomotory functions. Then it gives muscle attachment, and there is marrow in the long bones, so that helps for the erythropoiesis and other blood cell production, and it maintains the shape of the body. So first part is skull. So it is mainly skeleton of the head, and it is of many cranial bones like frontal, parietal, occipital, temporal, sphenoid, ethmoid, and the main function of the skull is to protect brain from the injury. Then second is the vertebral column. So it is a column present in the back side. So mainly there are vertebrae which are irregular in shape, and there are total 33 vertebrae in the vertebral column, and they are of different types according to the location. So they are cervical 7 number, thoracic 12 number, lumbar 5 in number, sacral and coccygeal 1 in number. And the function of the vertebral column is to support the skull and to protect spinal cord and then all the back movements, and helps in all the lower limb movements like walking, running, jumping. Then thoracic cage. So it is mainly made up of sternum, 1 bone, ribs, total 12 pairs, that is 24 in number, and thoracic vertebra 12. So main function of the sternum is to protect the internal organ, that is heart and lungs present in the chest. Then ribs, they are attached to the sternum, and few ribs are free. So those which are attached, they are called as true ribs, and those not attached, they are called as false ribs. So these are the thoracic cage which functions for the protection of the internal organs like heart, lungs and aorta. Then two girdles like pectoral girdle or shoulder girdle and pelvic girdle or hip girdle. So they are mainly for the upper limb movements. Pectoral girdle helps, so the all hand movements, and pelvic girdle helps for the lower limb movements. And the bones attached to pectoral girdle are mainly clavicle and scapula, and for the pelvic girdle they are mainly hip bones and femur. Then joint, it is a when many bones come together they form joint, and joint is mainly for the locomotion of the human body. There are of different joints like fibrous, cartilaginous, synovial joint, and inside the joint there is a fluid that is called as synovial fluid, which acts as a lubricant and provides nourishment and then maintains stability and prevent the end bones to get separated from each other. So because of the joints, there are all upper limb movements, lower limb movements, or locomotion, that is movement of the human body from one place to another place, is possible because of the joints. And the movements like flexion, extension, pronation, supination, eversion, so all these movements, neck movements, back movements, all these movements are possible because of the joint. So this is about the skeletal system in short. Thank you.
Hope you find this session useful for your understanding and for your exams. Thank you.